A nurse assesses a patient receiving haloperidol, Haldol. The nurse notices that the patient is shifting in the chair, rocking back and forth, and tapping both feet constantly. What is the most accurate term to document these findings? A. Dystonia. B. Tardive dyskinesia. C. Parkinsonism. D. Akathisia. Answer. D. Akathisia. Rationale. Haloperidol is a traditional antipsychotic medication with the adverse effects of extrapyramidal symptoms. Akathisia, or motor restlessness, is an extrapyramidal symptom. Dystonia manifests as severe spasm of the muscles of the tongue, face, neck, or back and may include upward deviation of the eyes, severe cramping, and impaired respiration. Tardive dyskinesia presents with involuntary twisting, writhing, worm-like movements of the tongue and face, lip smacking, and tongue flicking. Parkinsonism appears with bradykinesia, mask-like facies, drooling, tremor, rigidity, shuffling gait, and stooped posture. Caring for a patient in the emergency department who reports the onset of agitation, confusion, muscle twitching, diaphoresis, and fever about 12 hours after beginning a new prescription for escitalopram, Lexapro. Which is the most likely explanation for these symptoms? A. Depressive psychosis. B. Serotonin syndrome. C. Escitalopram overdose. D. Cholinergic crisis. Answer. B. Serotonin syndrome. Rationale. Serotonin syndrome can occur within 2 to 72 hours after initiation of treatment with an SSRI. The symptoms include altered mental status, incoordination, myoclonus, hyperreflexia, excessive sweating, tremor, and fever. The nurse is caring for a patient receiving fluoxetine, Prozac, for depression. Which adverse effect is most likely associated with this drug? A. Sexual dysfunction. B. Dry mouth. C. Orthostatic hypotension. D. Bradycardia. Answer. A sexual dysfunction. Rationale. Fluoxetine, Prozac, a selective serotonin reuptake inhibitor, SSRI, does not cause anticholinergic effects, orthostatic hypotension, or cardiotoxicity, as do the tricyclic antidepressants. The most common adverse effects are sexual dysfunction, nausea, headache, and central nervous system stimulation. The nurse is monitoring a patient with depression in the early phase of treatment with amitriptyline, Elavil. Which question is most important for the nurse to ask the patient? A. Have you noticed dry mouth or blurred vision? B. Have you had any changes in your urine function? C. When was your last bowel movement? D. Have you had any changes in your mood or anxiety level? Answer. D. Have you had any changes in your mood or anxiety level? Rationale. In the early phase of treatment for depression, suicide risk may increase. Patients should be monitored closely for worsening mood, unusual changes in behavior, and suicide risk. The other questions would be useful in assessing the patient for adverse effects of amitriptyline, Elavil, but assessing suicide risk is the most important intervention. The nurse is planning care for a patient taking imipramine, Tofranol. Which finding, if present, would most likely be an adverse effect of this drug? A. Blood pressure of 160/90ths of a millimeter Hg. Insomnia and diarrhea. C. Sedation and dry mouth. D. Tachypnea and wheezing. C. Sedation and dry mouth. Anticholinergic effects, dry mouth, blurred vision, constipation, tachycardia. Urinary retention and sedation are potential adverse effects of the tricyclic antidepressants, TCAs, such as imipramine, Tofranol. The most serious common adverse effect is orthostatic hypotension. Therefore, a blood pressure of 160/90ths of a millimeter Hg probably is not caused by this drug. Respiratory problems are not commonly associated with the TCAs. Which statement about aripiprazole would the nurse identify as true? A. It is the first representative of a unique class of antipsychotic drugs called dopamine system stabilizers. B. It must be administered on an empty stomach. C. Gynecomastia is a common adverse effect. D. It is safe to use in older adult patients with dementia-related psychosis. Answer. A. It is the first representative of a unique class of antipsychotic drugs called dopamine system stabilizers. Rationale. Aripiprazole is well absorbed in the presence and absence of food. And gynecomastia is not a side effect. Increased mortality is seen when aripiprazole is used in the treatment of older adult patients with dementia-related psychosis dopamine system stabilizers. When teaching the patient and family about clozapine therapy, which statements should the nurse include? Select all that apply. A. It is important for you to obtain ordered blood tests when taking this medication. B. Most patients who take this medication lose weight, so you should increase the number of calories you consume each day. C. If you experience increased urination, increased thirst, or increased appetite, contact your healthcare provider. D. Inform your healthcare provider if you are taking any medications to control seizures. E. Contact your healthcare provider if you experience any unexplained tiredness, shortness of breath, increased respirations, chest pain, or heart palpitations. Answer. It is important for you to obtain ordered blood tests when taking this medication. C. If you experience increased urination, increased thirst, or increased appetite, contact your healthcare provider. D. Inform your healthcare provider if you are taking any medications to control seizures. E. Contact your healthcare provider if you experience any unexplained tiredness, shortness of breath, increased respirations, chest pain, or heart palpitations. Rationale. Clozapine can cause agranulocytosis. Patients should be taught that clozapine will not be dispensed without repeated proof of blood counts. Patients taking clozapine are at increased risk of weight gain and dyslipidemia. They should be taught about the risk of weight gain and encouraged to control caloric intake and get regular exercise. Patients should be informed about early signs of infection, fever, sore throat, fatigue, mucous membrane ulceration, and instructed to notify their healthcare provider immediately if these should develop. Patients taking clozapine are at increased risk for the development of diabetes mellitus. They should be taught about symptoms of diabetes, e.g., hyperglycemia, polyuria, polydipsia, polyphagia, dehydration, and instructed to contact the prescriber if these occur. Clozapine should be used with caution in patients with seizure disorders. In rare cases, clozapine causes myocarditis. Patients should be informed about the signs and symptoms, e.g., unexplained fatigue, dyspnea, tachypnea, chest pain, palpitations, and advised to seek immediate medical attention if these develop. Clozapine should be withheld until myocarditis has been ruled out. If myocarditis is diagnosed, the drug should never be used again. Which statement does the nurse include when teaching a patient about antipsychotic drug therapy? Select all that apply. A. Restrict the use of antipsychotic drugs to 3 months to prevent the development of addiction. B. Dilute oral preparations in fruit juice to improve their palatability. C. Store oral preparations in a dark area. D. Do not make skin contact with these drugs. Flush the affected area with water if a spill occurs. E. Take an over-the-counter sleep aid if you have trouble falling asleep at night. Answer. B. Dilute oral preparations in fruit juice to improve their palatability. C. Store oral preparations in a dark area. D. Do not make skin contact with these drugs. Flush the affected area with water if a spill occurs. Patients should be informed that antipsychotic drugs do not cause addiction and that they should be taken as prescribed. Patients should be instructed to avoid all drugs with anticholinergic properties, including the antihistamines and certain over-the-counter sleep aids to prevent drug interactions. All other statements are appropriate to include in teaching the patient about the use of antipsychotic medications. The nurse is working with the multidisciplinary healthcare team to optimize the care of a patient with schizophrenia. Which concepts will guide the nursing care of this patient? Select all that apply. A. The second-generation antipsychotics generally are more effective than the first-generation agents. B. Most antipsychotic agents increase the risk of mortality in elderly patients with dementia. C. Antipsychotic depot preparations carry a greater risk of neuroleptic malignant syndrome. D. The lipid levels of patients receiving second-generation antipsychotics should be monitored. E. Schizophrenia is characterized by disordered thinking and loss of touch with reality. Answer. B. Most antipsychotic agents increase the risk of mortality in elderly patients with dementia. D. The lipid levels of patients receiving second-generation antipsychotics should be monitored. E. Schizophrenia is characterized by disordered thinking and loss of touch with reality. Rationale. The first and second-generation antipsychotics are considered equally effective. Even though the second-generation agents are more widely used today, most antipsychotics should be avoided in elderly patients with dementia because of increased mortality. Antipsychotic depot preparations are effective for the long-term control of schizophrenia and do not have an increased risk of side effects. Second-generation antipsychotics may cause weight gain, diabetes, and dyslipidemia. Schizophrenia is characterized by disordered thinking and loss of touch with reality. The nurse is caring for a patient receiving clozapine, Clozaril. Which assessment finding is most indicative of an adverse effect of this drug? A. Blood urea nitrogen level of 25 mg per deciliter. B. Blood glucose level of 60 mg per deciliter. C. Bilirubin level of 2.5 mg per deciliter. D. White blood cell, WBC count of 2000 per cubic millimeter. Answer. D. White blood cell, WBC count of 2000 per cubic millimeter. Rationale. Clozapine, an atypical antipsychotic, carries a risk of fatal agranulocytosis. For this reason, the WBC count should be monitored and should be greater than 3,500 per millimeter. 3. Renal function, blood urea nitrogen, should not be affected by clozapine. Clozapine may cause metabolic effects, including diabetes, that would result in an increased blood glucose level, greater than 110 mg per deciliter. Elevated bilirubin indicates liver disease and is not commonly an adverse effect of clozapine. The nurse has just administered the first dose of haloperidol, Haldol, to a patient with schizophrenia. Which finding, if present, is the most important for the nurse to report to the healthcare provider before administering the next dose of medication? A. Dry mouth. B. Temperature of 101 degrees Fahrenheit. C. BP of 104.70 seconds of a millimeter. HGD. Drowsiness. Answer. B. Temperature of 101 degrees Fahrenheit. Rationale. Sudden high fever is a symptom of neuroleptic malignant syndrome, a rare but serious complication of high-potency, first-generation antipsychotics, such as haloperidol, The other findings are potential side effects of the drug but would not necessarily need to be reported to the healthcare provider. A nurse is caring for several patients. In which patient is it appropriate to use the drug chlorpromazine, thorazine? Select all that apply. A. An 85-year-old man with Alzheimer's disease. B. A 78-year-old man with intractable hiccups. C. A 76-year-old woman with severe dementia. D. A 48-year-old woman with schizoaffective disorder. E. A 30-year-old man with anxiety and depression. Answer. B. A 78-year-old man with intractable hiccups. D. A 48-year-old woman with schizoaffective disorder. Rationale. The primary indications for chlorpromazine. A first-generation antipsychotic agent, or schizophrenia and other psychotic disorders. It may also be used for schizoaffective disorder, bipolar disorder, suppression of emesis, and relief of intractable hiccups. Antipsychotics are not used for dementia because of increased mortality. Chlorpromazine is not a primary treatment for Alzheimer's disease or depression. Which statement will the nurse include when teaching a patient about atomoxetine, Strattera? A. Atomoxetine has no potential for abuse. B. Atomoxetine is a central nervous system stimulant. C. Atomoxetine exerts its therapeutic effect by increasing the release of dopamine. D. Atomoxetine is not approved for the treatment of adults with attention deficit hyperactivity disorder. Answer. A. Atomoxetine has no potential for abuse. Rationale. Atomoxetine, Strattera, is a non-stimulant drug. It increases the release of norepinephrine, and it is approved for the treatment of adults with attention deficit hyperactivity disorder. It has no potential for abuse. The nurse identifies the mechanism of action of the amphetamines as what? Select all that apply. A. Causing the release of norepinephrine. B. Causing the release of epinephrine. C. Causing the release of dopamine. D. Inhibiting the reuptake of norepinephrine. E. Inhibiting the reuptake of dopamine. Answer. A. Causing the release of norepinephrine. C. Causing the release of dopamine. D. Inhibiting the reuptake of norepinephrine. E. Inhibiting the reuptake of dopamine. Rationale. The amphetamines act primarily by causing the release of norepinephrine, NA, and dopamine, DA, and partly by inhibiting the reuptake of both transmitters. These actions take place in the CNS and in peripheral nerves. Most pharmacologic effects result from the release of NA. Which statement or statements about caffeine does the nurse identify as true? Select all that apply. A. Caffeine can restore mental functioning during intoxication with alcohol. B. Caffeine promotes constriction of cerebral blood vessels. C. Caffeine promotes bronchodilation. D. Caffeine is a diuretic. E. Caffeine reduces the capacity for prolonged intellectual exertion. Answer. A. Caffeine can restore mental functioning during intoxication with alcohol. B. Caffeine promotes constriction of cerebral blood vessels. C. Caffeine promotes bronchodilation. D. Caffeine is a diuretic. Rationale. Caffeine increases the capacity for prolonged intellectual exertion. All other statements are true. A patient is started on a trial of dextroamphetamine, amphetamine, Adderall, for ADHD. What is the most likely nursing diagnosis for inclusion in the plan of care? A. Decreased cardiac output. B. Imbalanced nutrition, more than body requirements. C. Sleep pattern disturbance. D. Diversional activity deficit. Answer. C. Sleep pattern disturbance. Rationale. Insomnia is a common adverse effect of CNS stimulants. The nurse is teaching a patient with attention deficit, hyperactivity disorder, ADHD, about his prescription for methylphenidate, Ritalin LA. Which statement by the patient indicates that the teaching was effective? A. I will take my medication once per day in the morning. B. I will chew this medication and take it with my ice cream. C. I will take this medication right before my evening meal. D. I will use an alarm to remind me to take this medicine 3 times daily. Answer. A. I will take my medication once per day in the morning. Rationale. Ritalin LA is an extended-release formulation designed to be taken once daily. It should be taken in the morning and should not be crushed or chewed. The nurse is caring for a patient taking dextroamphetamine, dextrostat. Which symptom, if present, is most likely an adverse effect of this drug? A. Heart rate of 60 beats per minute. B. Respiratory rate of 10 breaths per minute. C. Weight gain. D. Restlessness. Answer. D. Restlessness. Rationale. The adverse effects of amphetamines include central nervous system, CNS, stimulation, insomnia, restlessness, talkativeness, weight loss, cardiac stimulation, dysrhythmias, angina, hypertension, and psychosis, paranoia. A patient has been diagnosed with performance anxiety. The nurse anticipates use of which drug to treat this psychologic disorder? A. Clonazepam, Clonopin, B. Alprazolam, Xanax, C. Propranolol, Inderal, D. Sertraline, Zoloft. Answer. C. Propranolol, Inderal. Rationale. Propranolol, Inderal, and other beta blockers can benefit patients with performance anxiety when taken 1 to 2 hours before a scheduled performance. Beta blockers can reduce symptoms caused by autonomic hyperactivity, e.g., tremors, sweating, tachycardia, palpitations. Doses are relatively small, e.g., only 10 to 80 milligrams for propranolol. The nurse identifies which antidepressant is effective in the treatment of generalized anxiety disorder, GAD. Select all that apply. A. Fluoxetine, Prozac, B. Venlafaxine, Effexor XR, C. Paroxetine, Paxil, D. Escitalopram, Lexapro, E. Duloxetine, Cymbalta. Answer. B. Venlafaxine, Effexor XR, C. Paroxetine, Paxil, D. Escitalopram, Lexapro, E. Duloxetine, Cymbalta. Rationale. Fluoxetine, Prozac, is not approved for the treatment of generalized anxiety disorder. All the other medications listed are approved for the treatment of GAD. The nurse is caring for a patient taking buspirone, Buspar. Which statement by the patient indicates a need for further teaching about this drug? A. This medication should not make me feel drowsy. B. This medication should help me feel less anxious. C. I will drink grapefruit juice instead of coffee with breakfast. D. I will take my medication 3 times per day. Answer. C. I will drink grapefruit juice instead of coffee with breakfast. Rationale. Grapefruit juice can greatly increase buspirone levels and should be avoided. The other statements are appropriate. Which drug does the nurse identify as a selective serotonin reuptake inhibitor? Select all that apply. A. Bupropion, Wellbutrin, B. Imipramine, Tofranol, C. Fluoxetine, Prozac, D. Desvenlafaxine, Pristiq, E. Sertraline, Zoloft. Answer. C. Fluoxetine, Prozac, E. Sertraline, Zoloft. Rationale. Fluoxetine, Prozac, and sertraline, Zoloft, are selective serotonin reuptake inhibitors. Bupropion, Wellbutrin, is an atypical antidepressant. Imipramine, Tofranil, is a tricyclic antidepressant. Desvenlafaxine, Pristiq, is a serotonin, norepinephrine reuptake inhibitor, SNRI. The nurse is caring for a group of patients being treated for depression. Why might an SSRI be chosen over a TCA? A. To reduce the risk of suicide with overdose. B. To avoid weight gain and other gastrointestinal, GI, effects. C. To help prevent sexual dysfunction. D. To prevent the risk of serotonin syndrome. Answer. A. To reduce the risk of suicide with overdose. Rationale. The SSRIs may be chosen because they have fewer side effects and are safer with overdose. However, the SSRIs can cause sexual dysfunction and weight gain, and they carry a risk of serotonin syndrome. The nurse is preparing to administer phenelzine, Nardial, to a patient with depression. Why is this drug considered a second or third line agent in the treatment of depression? A. It increases the risk of suicide in the early phase. B. It is less effective than the tricyclic antidepressants. C. It increases the risk of psychoses and Parkinsonism. D. It has more side effects and drug interactions. Answer. D. It has more side effects and drug interactions. Rationale. Phenelzine, Nardial, a monoamine oxidase inhibitor, MAOI, is considered a second or third line treatment because of the risk of triggering hypertensive crisis when the patient eats foods high in tyramine. Also, an increased incidence of drug-drug interactions is seen with phenelzine. Phenelzine does not pose an increased risk for suicide, psychoses, or Parkinsonism, and it is as effective as the tricyclic and SSRI antidepressants. The nurse is teaching a patient who has a new prescription for citalopram, Celexa. Which statement is appropriate to include in the teaching plan? Select all that apply. A. This medication may cause some sexual side effects. Let your healthcare provider know about this if it occurs. B. When you stop taking this medication, you should not withdraw it abruptly. C. You will need to move slowly from a sitting to a standing position to prevent dizziness from low blood pressure. D. This medication often causes drowsiness. You should take it at bedtime. E. Let your family or your healthcare provider know if you experience a worsening mood, agitation, or increased anxiety. Answer. A. This medication may cause some sexual side effects. Let your healthcare provider know about this if it occurs. B. When you stop taking this medication, you should not withdraw it abruptly. E. Let your family or your healthcare provider know if you experience a worsening mood, agitation, or increased anxiety. Rationale. Citalopram, Celexa, and other SSRIs can cause sexual side effects that patients may be hesitant to report. SSRIs should be withdrawn slowly to prevent dizziness, headache, dysphoria, and/or other symptoms of withdrawal. The SSRIs do not generally cause orthostatic hypotension or drowsiness. All antidepressants initially increase the risk of suicide, and patients should be monitored for worsening mood and other signs of suicide risk. The selective serotonin reuptake inhibitors, SSRIs, are recommended therapy for a number of psychologic disorders. The nurse identifies the SSRIs as effective for the treatment of patients with which psychologic disorder or disorders. Select all that apply. A. Depression. B. Panic disorder. C. Social anxiety disorder. D. Post-traumatic stress disorder. E. Obsessive-compulsive disorder. Answer. A. Depression. B. Panic disorder. C. Social anxiety disorder. E. Obsessive-compulsive disorder. Rationale. Neither the SSRIs nor any other drugs, for that matter, have proved effective in the treatment of post-traumatic stress disorder. SSRIs are used to treat the other psychologic disorders listed. A distraught patient is admitted to the emergency department with symptoms of palpitations, tachycardia, chest pain, and shortness of breath. The physical examination reveals no physiologic basis for the symptoms. Which diagnosis therefore is most likely? A. Panic disorder. B. Bipolar disorder. C. Generalized anxiety disorder. D. Clinical depression. Answer. A panic disorder. Rationale. Panic disorder is characterized by symptoms similar to those of a myocardial infarction, MI. Patients often fear losing control and dying and also may experience dizziness, nausea, depersonalization, and tingling or numbness in the hands. Generalized anxiety disorder is characterized by excessive worrying about events, but it also can include trembling, muscle tension, restlessness, palpitations, tachycardia, sweating, and clammy hands. Bipolar disorder is characterized by mood swings with periods of mania and depression. The nurse is caring for a patient receiving buspirone, Buspar, for the treatment of anxiety. Which symptom is most likely explained as an adverse effect of this drug? A. Drowsiness. B. Risk for abuse. C. Dizziness. D. Weight gain. Answer. C. Dizziness. Rationale. Buspirone is an anti-anxiety medication with few side effects. The most common effects are dizziness, nausea, headache, nervousness, lightheadedness, and excitement. Buspirone does not cause drowsiness, risk for abuse, or weight gain. A family member of a patient who is experiencing a severe manic episode asks the nurse why the patient is receiving an antipsychotic medication. The nurse informs the family member that antipsychotics are used in the treatment of severe manic episodes to do what? A. Help control symptoms during the severe manic episode. B. Elevate mood during the severe manic episode. C. Produce sedating effects during the severe manic episode. D. Reduce the amount of physical pain the patient experiences during the severe manic episode. Answer. A. Help control symptoms during the severe manic episode. Rationale. Antipsychotic drugs are given to help control symptoms during severe manic episodes, even if psychotic symptoms are absent. Benzodiazepines are given for their sedating effects. Antidepressants help elevate mood during manic episodes. A nurse assesses a patient who takes a maintenance dose of lithium carbonate, Lithobid, for bipolar disorder. The patient complains of hand tremor, nausea, vomiting, and diarrhea. The patient's gait is unsteady. The patient most likely has done what? A. Consume some foods high in tyramine. B. Not taken the lithium as directed. C. Develop tolerance to the lithium. D. Develop lithium toxicity. Answer. D. Develop lithium toxicity. Rationale. Early lithium toxicity is evidenced by diarrhea, anorexia, muscle weakness, nausea, vomiting, tremors, slurred speech, and drowsiness. Later signs include blurred vision, seizures, trembling, confusion, and ataxia. The nurse is caring for a patient taking lithium, Lithobid. The nurse understands that many drugs interact with lithium. Which agent is safe to administer with lithium? A. Ibuprofen, Motrin, for muscle pain. B. Hydrochlorothiazide, HCTZ, for edema. C. Aspirin, ASA, for mild headache. D. Diphenhydramine, Benadryl, for cold symptoms. Answer. C. Aspirin, ASA, for mild headache. Rationale. Aspirin is safe to use as an analgesic with lithium. Other nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, can increase lithium levels by as much as 60%. Diuretics increase lithium levels by reducing the serum sodium level. Diphenhydramine has anticholinergic properties and can aggravate lithium-induced polyuria by causing urinary hesitancy. The nurse identifies which most common serious adverse effect of TCA therapy? A. Sedation. B. Orthostatic hypotension. C. Skin rash. D. Sexual dysfunction. Answer. B. Orthostatic hypotension. Rationale. Orthostatic hypotension is the most common adverse effect of tricyclic antidepressant therapy. The nurse knows that which statements about postpartum depression are true? Select all that apply. A. About 80% of women experience depressive symptoms after giving birth. B. Thyroid insufficiency has been indicated as a contributing factor in postpartum depression. C. Monoamine oxidase inhibitors are the first-line agents of choice for the treatment of postpartum depression. D. Once a woman has had postpartum depression, it will not recur with future deliveries. E. Sertraline, Zoloft, is the drug of choice for treating postpartum depression in breastfeeding mothers. Answer. A. About 80% of women experience depressive symptoms after giving birth. B. Thyroid insufficiency has been indicated as a contributing factor in postpartum depression. E. Sertraline, Zoloft, is the drug of choice for treating postpartum depression in breastfeeding mothers. Rationale. The drug of choice for postpartum depression is an SSRI, such as sertraline, Zoloft. Because these drugs are effective, well tolerated, and present little risk of toxicity if taken in overdose. If a woman has responded to another antidepressant in the past, that drug should be used first. The risk of relapse is high, as is the risk of postpartum depression with subsequent pregnancies. The statements in options C and D are false. The nurse is caring for a patient with severe generalized anxiety disorder. Which agent would be most effective for immediate stabilization? A. Venlafaxine, Effexor. B. Buspirone, Buspar. C. Paroxetine, Paxil. D. Alprazolam, Xanax. Answer. D. Alprazolam, Xanax. Rationale. Alprazolam, a benzodiazepine, would provide the most rapid onset of relief. Buspirone, paroxetine, and venlafaxine are also first-line agents for the treatment of generalized anxiety disorder, but their onset is delayed. They are preferred for long-term management. When comparing benzodiazepines to barbiturates, the nurse identifies which statement about benzodiazepines is true. Select all that apply. A. Benzodiazepines have a high safety profile. B. Benzodiazepines have a significant ability to depress central nervous system, CNS function. C. Benzodiazepines are associated with a high suicide potential. D. Benzodiazepines have a low ability to cause tolerance. E. Benzodiazepines have a low abuse potential. Answer. A. Benzodiazepines have a high safety profile. D. Benzodiazepines have a low ability to cause tolerance. E. Benzodiazepines have a low abuse potential. Rationale. Statements A, D, and E are true. Compared to barbiturates, benzodiazepines have a low suicide potential and low ability to cause CNS depression. Which statement or statements about Zaloplan, Sonata, does the nurse identify as true? Select all that apply. A. Zaloplan, Sonata, is a benzodiazepine. B. Zaloplan, Sonata, is indicated for long-term management of insomnia. C. Zaloplan, Sonata, is used to maintain sleep throughout the night. D. Zaloplan, Sonata, should not be administered with cimetidine, Tagamet. E. Zaloplan, Sonata, interacts with the neurotransmitter GABA. Answer. D. Zaloplan, Sonata, should not be administered with cimetidine, Tagamet. E. Zaloplan, Sonata, interacts with the neurotransmitter GABA. Rationale. Zaloplan, Sonata, belongs to a new class of drugs called the pyrazolopyrimidines. It is indicated for short-term management of insomnia. Zaloplan has a rapid onset and short duration of action and therefore is beneficial for initiating sleep but not for maintaining it throughout the night. Zaloplan and cimetidine should not be administered together. Zaloplan interacts with the neurotransmitter GABA. The nurse is caring for a patient with a seizure disorder who takes meflobarbital, Mebaril, at bedtime each night to control seizures. Which symptom, if present, would most likely indicate an adverse effect of this drug? A. Morning sedation. B. A respiratory rate of 30 breaths per minute. C. Constipation. D. A blood pressure of 168/88 of a millimeter Hg. Answer. A morning sedation. Rationale. The adverse effects of the barbiturates include respiratory depression, risk of suicide, risk of abuse, and hangover, sedation, impaired judgment, and reduced motor skills. Alprazolam, Xanax, is prescribed for an adult with panic attacks. The nurse recognizes that this drug exerts its therapeutic effect by interacting with which neurotransmitter? A. Norepinephrine. B. Acetylcholine. C. Serotonin. 5-HT. D. Gamma-aminobutyric acid, GABA. Answer. D. Gamma-aminobutyric acid, GABA. Rationale. Alprazolam is a benzodiazepine. This class of drugs reduces anxiety by potentiating the action of GABA. The nurse is teaching a patient with a new prescription for alprazolam, Xanax. Which statement is the most appropriate to include in the teaching plan? A. When it is time to discontinue this drug, you will need to taper it off slowly. B. Protect your skin from the sun to prevent rash and exaggerated sunburn. C. Increase your intake of fluid and high-fiber foods to prevent constipation. D. Take this medication on an empty stomach at least 2 hours after meals. Answer. A. When it is time to discontinue this drug, you will need to taper it off slowly. Rationale. Alprazolam, Xanax, is a benzodiazepine for which abrupt discontinuation can precipitate withdrawal symptoms. Patients should withdraw the drug gradually over several weeks. The other statements are not related to alprazolam, Xanax. What statement or statements about the treatment of bipolar disorder does the nurse identify as true? Select all that apply. A. Mood stabilizers are used to prevent recurrent manic depressive episodes. B. Antipsychotics are used to treat depressive episodes. C. Antidepressants should be used with mood stabilizers in the treatment of patients with bipolar depression. D. Lithium and valproate are the preferred mood stabilizers for BPD. E. A lithium level of 2.0 MEq/L is considered therapeutic. Answer. Mood stabilizers are used to prevent recurrent manic depressive episodes. C. Antidepressants should be used with mood stabilizers in the treatment of patients with bipolar depression. D. Lithium and valproate are the preferred mood stabilizers for BPD. Rationale. The statements in options A, C, and D are true. Antipsychotics are used to treat manic episodes. A lithium level above 1.5 MEq/L is considered to be above the therapeutic index. The nurse is caring for a group of patients who have been prescribed sedative hypnotic agents. Which agent has the greatest abuse potential? A. Diazepam, Valium, B. Triazolam, Halcion, C. Zolpidem, Ambien, D. Phenobarbital, luminal sodium. Answer: D. Phenobarbital, luminal sodium. Rationale: phenobarbital is a barbiturate drug that carries a higher abuse potential than the benzodiazepine or benzodiazepine-like drugs. A patient has been taking the monoamine oxidase inhibitor, MAOI, phenelzine, Nardial, for 6 months. The patient wants to go to a party and asks the nurse, "Will just one beer be a problem?" Which advice from the nurse is correct? A. You can drink beer as long as you have a designated driver. B. Now that you've had the last dose of that medication, there will be no further dietary restrictions. C. If you begin to experience a throbbing headache, rapid pulse, or nausea, you'll need to stop drinking. D. You need to avoid all foods that contain tyramine, including beer, while taking this medication. Answer: D. You need to avoid all foods that contain tyramine, including beer, while taking this medication. Rationale: foods containing tyramine, such as beer and aged cheeses, should be avoided while a patient is taking in MAOI. Drinking beer while taking in MAOI may precipitate a dangerous hypertensive crisis. The other options are incorrect. A patient has been taking haloperidol, Haldol, for 3 months for a psychotic disorder, and the nurse is concerned about the development of extrapyramidal symptoms. The nurse will monitor the patient closely for which effects: A. Increased paranoia. B. Drowsiness and dizziness. C. Tremors and muscle twitching. D. Dry mouth and constipation. Answer: C. Tremors and muscle twitching. Rationale: extrapyramidal symptoms are manifested by tremors and muscle twitching, and the incidence of such symptoms is high during haloperidol therapy. The other options are incorrect when a patient is receiving a second-generation antipsychotic drug, such as risperidone, Risperdal. The nurse will monitor for which therapeutic effect: A. Fewer panic attacks. B. Decreased paranoia and delusions. C. Decreased feeling of hopelessness. D. Improved tardive dyskinesia. Answer: B. Decreased paranoia and delusions. Rationale: the therapeutic effects of the antipsychotic drugs include improvement in mood and affect, and alleviation or decrease in psychotic symptoms, decrease in hallucinations, paranoia, delusions, garbled speech. Tardive dyskinesia is a potential adverse effect of these drugs. The other options are incorrect. Before beginning a patient's therapy with selective serotonin reuptake inhibitor, SSRI, antidepressants, the nurse will assess for concurrent use of which medications are medication class: A. Aspirin. B. Anticoagulants. C. Diuretics. D. Nonsteroidal anti-inflammatory drugs. Answer: B. Anticoagulants. Rationale: use of selective serotonin reuptake inhibitor, SSRI, antidepressants with warfarin results in an increased anticoagulant effect. SSRI antidepressants do not interact with the other drugs or drug classes listed. The nurse reads in the patient's medication history that the patient is taking buspirone, Buspar. The nurse interprets that the patient may have which disorder: A. Anxiety disorder. B. Depression. C. Schizophrenia. D. Bipolar disorder. Answer: A. Anxiety disorder. Rationale: Buspirone is indicated for the treatment of anxiety disorders, not depression, schizophrenia, or bipolar disorder. Which statements are true regarding the selective serotonin reuptake inhibitors, SSRIs? Select all that apply. A. Avoid foods and beverages that contain tyramine. B. Monitor the patient for extrapyramidal symptoms. C. Therapeutic effects may not be seen for about 4 to 6 weeks after the medication is started. D. If the patient has been on Maui, a 2 to 5 week or longer time span is required before beginning an SSRI medication. E. These drugs have anticholinergic effects, including constipation, urinary retention, dry mouth, and blurred vision. F. Cogentin is often also prescribed to reduce the adverse effects that may occur. Answer. C. Therapeutic effects may not be seen for about 4 to 6 weeks after the medication is started. D. If the patient has been on Maui, a 2 to 5 week or longer time span is required before beginning an SSRI medication. Rationale. During SSRI medication, therapeutic effects may not be seen for 4 to 6 weeks. To prevent the potentially fatal pharmacodynamic interactions that can occur between the SSRIs and the MAOIs, a 2 to 5 week washout period is recommended between uses of these two classes of medications. The other options apply to other classes of psychotherapeutic drugs, not SSRIs. A patient who has been taking a selective serotonin reuptake inhibitor, SSRI, is complaining of feeling so badly when he started taking an over-the-counter St. John's wort herbal product at home. The nurse suspects that he is experiencing serotonin syndrome. Which of these are symptoms of serotonin syndrome? Select all that apply. A. Agitation. B. Drowsiness. C. Tremors. D. Bradycardia. E. Sweating. F. Constipation. Answer A. Agitation. C. Tremors. E. Sweating. Rationale. Common symptoms of serotonin syndrome include delirium, agitation, tachycardia, sweating, hyperreflexia, shivering, and coarse tremors. The nurse is reviewing medications used for depression. Which of these statements is a reason that selective serotonin reuptake inhibitors, SSRIs, are more widely prescribed today than tricyclic antidepressants? A. SSRIs have fewer sexual side effects. B. Unlike tricyclic antidepressants, SSRIs do not have drug-food interactions. C. Tricyclic antidepressants cause serious cardiac dysrhythmias if an overdose occurs. D. SSRIs cause a therapeutic response faster than tricyclic antidepressants. Answer. C. Tricyclic antidepressants cause serious cardiac dysrhythmias if an overdose occurs. Rationale. Death from overdose of tricyclic antidepressants usually results from either seizures or dysrhythmias. SSRIs are associated with significantly fewer and less severe systemic adverse effects, especially anticholinergic and cardiovascular adverse effects. The other options are incorrect. A patient wants to take a ginseng dietary supplement. The nurse instructs the patient to look for which potential adverse effect. A. Drowsiness. B. Palpitations and anxiety. C. Dry mouth. D. Constipation. Answer. B. Palpitations and anxiety. Rationale. Elevated blood pressure, chest pain or palpitations, anxiety, insomnia, headache, nausea, vomiting, and diarrhea are potential adverse effects of ginseng. Drowsiness, difficulty with urination, and constipation are not potential adverse effects of ginseng. The Nurse is reviewing the food choices of a patient who is taking a monoamine oxidase inhibitor, MAOI. Which food choice would indicate the need for additional teaching? A. Orange juice. B. Fried eggs over easy. C. Salami and Swiss cheese sandwich. D. Biscuits and honey. Answer. C. Salami and Swiss cheese sandwich. Rationale. Aged cheeses, such as Swiss or cheddar cheese, and salami contain tyramine. Patients who are taking MAOIs need to avoid tyramine-containing foods because of a severe hypertensive reaction that may occur. Orange juice, eggs, biscuits, and honey do not contain tyramine. Chlorpromazine, thorazine, is prescribed for a patient, and the nurse provides instructions to the patient about the medication. The nurse includes which information? A. The patient needs to avoid caffeine while on this drug. B. The patient needs to wear sunscreen while outside because of photosensitivity. C. Long-term therapy may result in nervousness and excitability. D. The medication may be taken with an antacid to reduce gastrointestinal upset. Answer. B. The patient needs to wear sunscreen while outside because of photosensitivity. Rationale. Sun exposure and tanning booths need to be avoided with conventional antipsychotics because of the adverse effect of photosensitivity. Instruct the patient to apply sunscreen liberally and to wear sun-protective clothing and hats. The wife of a patient who has been diagnosed with depression calls the office and says, "It's been an entire week since he started that new medicine for his depression, and there's no change. What's wrong with him?" What is the nurse's best response? A. The medication may not be effective for him. He may need to try another type. B. It may take up to 6 weeks to notice any therapeutic effects. Let's wait a little longer to see how he does. C. It sounds like the dose is not high enough. I'll check about increasing the dosage. D. Some patients never recover from depression. He may not respond to this therapy. Answer. B. It may take up to 6 weeks to notice any therapeutic effects. Let's wait a little longer to see how he does. Rationale. Patients and family members need to be told that antidepressant drugs commonly require several weeks before full therapeutic effects are noted. The other answers are incorrect. The nurse identifies which drug is the principal mood stabilizer used in the treatment of bipolar disorder. Select all that apply. A. Lithium. B. Risperidone. C. Divalproex sodium, valproate. D. Carbamazepine. E. Venlafaxine, Effexor. Answer. A. Lithium. C. Divalproex sodium, valproate. D. Carbamazepine. Rationale. Lithium, divalproex sodium, valproate, and carbamazepine are the principal mood stabilizers used in the treatment of bipolar disorder. Risperidone is an antipsychotic used in the management of bipolar disorder. Venlafaxine, Effexor, is an antidepressant used in the treatment of bipolar disorder. A patient has been admitted to the emergency department with a suspected overdose of a tricyclic antidepressant. The nurse will prepare for what immediate concern: A. Hypertension. B. Renal failure. C. Cardiac dysrhythmias. D. Gastrointestinal bleeding. Answer. C. Cardiac dysrhythmias. Rationale. Tricyclic antidepressant overdoses are notoriously lethal. The primary organ systems affected are the central nervous system and the cardiovascular system. And death usually results from either seizures or dysrhythmias. While monitoring a depressed patient who has just started SSRI antidepressant therapy, the nurse will observe for which problem during the early time frame of this therapy: A. Hypertensive crisis. B. self-injury or suicidal tendencies. C. Extrapyramidal symptoms. D. Loss of appetite. Answer. B. Self-injury or suicidal tendencies. Rationale. In 2005, the U.S. Food and Drug Administration, FDA, issued special black box warnings regarding the use of all classes of antidepressants in both adult and pediatric patient populations. Data from the FDA indicated a higher risk for suicide in patients receiving these medications. As a result, current recommendations for all patients receiving antidepressants include regular monitoring for signs of worsening depressive symptoms, especially when the medication is started, or the dosage is changed. The other options are incorrect. A 22-year-old patient has been taking lithium for 1 year, and the most recent lithium level is 0.9 MEq/L. Which statement about the laboratory result is correct? A. The lithium level is therapeutic. B. The lithium level is too low. C. The lithium level is too high. D. Lithium is not usually monitored with blood levels. Answer. A. The lithium level is therapeutic. Rationale. Desirable long-term maintenance lithium levels range between 0.6 and 1.2 MEq/L. The other responses are incorrect. A patient has been taking the selective serotonin reuptake inhibitor, SSRI, sertraline, Zoloft, for about 6 months. At a recent visit, she tells the nurse that she has been interested in herbal therapies and wants to start taking St. John's wort. Which response by the nurse is appropriate? A. That should be no problem. B. Good idea, hopefully you'll be able to stop taking the Zoloft. C. Be sure to stop taking the herb if you notice a change in side effects. D. Taking St. John's wort with Zoloft may cause severe interactions and is not recommended. Answer. D. Taking St. John's wort with Zoloft may cause severe interactions and is not recommended. Rationale. The herbal product St. John's wort must not be used with SSRIs. Potential interactions include confusion, agitation, muscle spasms, twitching, and tremors. The other responses by the nurse are inappropriate. A patient with the diagnosis of schizophrenia is hospitalized and is taking a phenothiazine drug. Which statement by this patient indicates that he is experiencing a common adverse effect of phenothiazines? A. I can't sleep at night. B. I feel hungry all the time. C. Look at how red my hands are. D. My mouth has been so dry lately. Answer. D. My mouth has been so dry lately. Rationale. Phenothiazines produce anticholinergic-like adverse effects of dry mouth, urinary hesitancy, and constipation.